Hello my friend, and welcome to this session on Hypnodontics, the mind-body dental specialty. By the end of this video, you will be able to understand a little bit more about hypnosis and how it relates to dentistry, and when it's good to use it and when it's not good to use it, and how you can learn and use the very simple skills of effective hypnotic communication to use with your patients to influence them to want to do what's in their best interest. My name is Juan Acosta, and I am a natural comfort specialist from Hypnodontics.com. That means that I am a hypnotist by trade, and by chance I was turned into a dental office manager and patient coordinator, and I got to see a lot of the inside of dental practices also as a consultant later on. So I want to share in this video my story and how it relates to your practice and how it can benefit you and your patients. When I first started, I was walking the pavement, literally knocking on doors and coming into dental practices with my nice brochure and my business cards and talking to the receptionist and saying, hey, here's my information. I'm a hypnotist in town and I can help your patients who are grinding their teeth, who are smoking, who are nail biting, who are anxious to be at the dentist, all the typical hypnotherapy things. And I didn't really get any results, which of course, after working inside dentistry, I realized why I didn't get any results. It's hard for you as a dentistry professional in any role of the practice to want to throw a wrench into a system that you have that's already working in some ways, right? Sending somebody to a hypnotist would be, in my opinion, kind of throwing a wrench into a system that's already working by just like helping somebody else build their practice. So I didn't really understand or realize sort of the flaw in my plan early on. After a couple of months, I was pretty discouraged of how many doors I had knocked on, how much information I had dropped off, how much work and effort I had put in, and I had gotten no referrals. In the middle of my discouragement, I went to a friend's birthday party, which was held in a beautiful terrace overlooking the city of San Diego. This was in November of 2012. And I remember distinctly just hanging out with friends and my buddy, whose birthday it was, getting up on his couch and going, hey everybody, hey, who wants to see a hypnosis show? My friend's a hypnotist. And literally put me on the spot immediately. Well, my start in hypnosis was doing street hypnosis and stage hypnosis. So I had no problem with the show, but it was still a little bit jarring to be thrown into it. But I took it. It was an opportunity for me to showcase my skill, and I did. Well, after I did a little show, a 15, 20-minute show, and everybody was, wow, this is amazing. I had this one guy that approached me and said, hey, this was really cool. But why? Like, is it just for fun? I mean, there must be something else that you do with this that's important. And I looked at him and I said, yes, absolutely. I'm here. I mean, this was just a one-off for me right now because I haven't done any street or stage for a while. I'm here hoping to work with dentists. I am knocking on doors and blah, blah, blah. I gave him the same story that I basically just gave you in a way. And he goes, well, that's very serendipitous because I know I work with about 117 dentists. That was the number. I remember the 117. And in the moment I thought, wow, that's amazing. Let's connect, right? So we talked a little more. And he said, well, before I refer you to my dentist, because these are my trusted people, they're my clients. He is a sales rep, one of the very top in the area where I was. So in talking to him, he said, well, let me maybe get to know you a little bit better. This was the first time we were meeting. And after we get to know each other and I kind of get to see what your services are like or what you're about, then I will know who to connect you with. Well, sure enough, we did a couple of sessions, sort of sales improvement, improving his confidence, his wanting to have more abundance in life, just sort of creating new pathways and new ways for him to achieve more, to perform at a higher level. And after a couple of sessions, he said, man, this is amazing. I know exactly who we need to talk to. Let me make an appointment for us. Well, sure enough, about another week later or so, he says, hey, I have an appointment with this doctor close to your office. How about we meet there tomorrow at 11:30 or something along those lines? He had basically set up a time, a block of time with the doctor. He was going to go in and talk to him about his supplies, and in the same time, he was going to introduce me. So this was a huge moment for me because, well, I'll tell you why. I jumped right into that opportunity. Of course, I went in, I met the doctor, and after about 30 minutes of chatting, the doctor says, well, you don't strike me like somebody that just wants referrals. You don't want just to build your private practice, do you? What is it that you're looking for? And I said, well, actually, doctor, what I'd love to do is to speak in front of audiences, to teach dental practices how to do certain things that I do so that they can have a better delivery for their patients. And he said, well, that's really interesting because I have a presentation. We're doing an implant presentation in about 3 weeks. Do you want to participate? Do you want to be part of it? I was like, yes, of course. I jumped right at that opportunity. He said, well, we have, my partner and I, we're going to be doing the speaking, but we need an MC. We need somebody that can kind of joke around and handle the situation between one speaker and the next, and kind of make lively situation. And I thought, well, yeah, I think I can do that. Let's do it. Well, we actually ended up spending that day. I think doctor had blocked like 30 minutes for me, and we ended up spending like an hour and a half. I'm sure he was late. I have no idea what happened with his schedule that day, or if somebody didn't show up or whatever. But I know we spent a long time talking. Really hit it off. To the point where my friend, the sales rep, was like, hey, do you guys mind if I leave? I got other appointments. And he left about 30 minutes later, 40 minutes later, and we continued talking for a while and kind of making plans. Well, the next date rolled around, which was about 3 weeks later for the presentation. And he and his partner did the implant presentation. They were selling an implant course. And as expected, I was there to MC, and I did my thing, and that went well. So well that after the presentation, doctor pulled me aside and said, hey, you know what? I have another practice, an emergency dental clinic that that needs a manager. I don't have a manager there, and you don't need to know anything about dentistry. The stuff that you need to know, I'll teach you. It's stuff that you can learn. You don't have to go to school for certain things, and the only thing that you really need is good people skills, and you have those. So how about it? And I was like, yes, of course. If you can tell anything about me, I will jump at opportunities such as those, even if they are uncomfortable for me, because at that moment, I'm like, doctor, I don't know the first thing about dentistry. I mean, it's obvious. I know a few things about hypnosis with dentistry and why patients grind their teeth and how to help them, but I don't know, for example, even the number of the teeth, So this were the kind of the lack of knowledge that I had going in, and that most hypnotists and hypnotherapists bring to the table. We just don't know what we don't know. Well, my crash course in dentistry was the real deal. I jumped in, and immediately as an office manager, they had a really solid digital marketing strategy that got the phones ringing all day long and all night, because this was a 24-hour clinic where we set up appointments basically overnight. There weren't live calls, but there was an answering service, and then in the morning at 7 a.m. I would return all the phone calls and set up the appointments for the day, even through the night. So we did see patients late at night, but we didn't make appointments after 11 p.m. Those would go to the messages. So to make a long story short, I got a lot of work with patients, a lot of talking with patients and for different issues that they had very, very quickly. I'm talking dozens and dozens of phone calls and interactions with patients on a daily basis. And what that did for me is it got me to understand that dentistry as a profession, dentistry as a whole, needs different help than just helping the patients who are grinding, the patients who are anxious, the patients who are smoking. Those are great things to offer, great adjunct services, which is what hypnotherapy is good for. But when I started working with patients and interacted with them, I realized that the relationship between dental patient and dental practitioner or anybody working in the office starts in a sort of adversarial way, and it makes things really hard. It makes you sort of start behind the 8 ball, where you have to be selling and explaining and convincing. And if you know that, you probably have to do that too. I mean, convincing is never fun, right? Having or feeling like you have to twist somebody's arm, especially when you're talking about them doing something that's in their best interest, it just doesn't feel like fun. It wasn't my idea of fun to talk to them on the phone and them saying, oh my God, I have a toothache, I need help with this and that, and me taking them through the process, and then them not showing up for their appointment, for example, simply disrespecting it, going, well, I feel a little bit better now. It's like, come on, don't you want to do what's in your best interest, right? So the idea of having to convince patients and twist their arms is really annoying, in my opinion. I don't know if you feel the same, but if you do, then let's think of it in a slightly different way, because just like we feel like we have to convince, the reality is that we have the responsibility and the duty to influence those patients to want to do what's in their best interest, right? If we are so not caring about their best interest that we don't really push a little bit more in a nice way, in a good way, that doesn't feel like you're selling, then you're doing your clients, your patients, a disservice, right? You are not really elevating the standard of care in your office, delivering the proper sort of service, cohesive, holistic sort of service that you can offer in your dental practice. Well, so after I worked for a few months in the dental clinic, things were going well. I learned how to take the phones. I learned how to reduce the no-shows. I learned how to work in dentistry in that time, placing orders, doing a little bit of HR with the doctors and assistants. It was a really solid experience, I think, especially for a hypnotist who is not in the field at all and just kind of stepped into a position. So it gave me a really unique perspective because I viewed everything through the lenses of communication. Hypnosis is nothing but effective communication. So I viewed everything through that lens and I realized, well, doctor, you're saying that in a way that's making the patient feel more uncomfortable than they were. Well, you know what? You're saying that in a way that the patient's feeling like there's a little tension between you. And I realized that besides the help that we already give as an adjunct profession to dentistry, there should be a dental specialty, which I affectionately call Hypnodontics, which is the mind-body dental specialty. Basically a person, just like there's an endodontist, a periodontist, an orthodontist, there's a person that deals with the mental and emotional challenges of dentistry, the challenges that keep dentistry from growing, from improving the perception in the public and becoming a better profession, a more enjoyable profession that is not plagued, for example, by one of the highest suicide rates in anywhere, right? So the profession of hypnodontics involves not only the dental hypnosis aspect of things, as in helping patients who are grinding or smoking or nail biting to stop those habits, or helping patients who are fearful to not have fear, or helping patients who are in pain or they're allergic to anesthetic and they have to have surgery without it, for example. Those are dental hypnosis. And then what I like to add on, where it comes to hypnodontics, is the idea that the responsibility, bringing it back to this convincing versus influencing, the responsibility that we have as dental practice workers, anybody in dentistry, to influence those patients is a great responsibility and we should take it seriously. And if we just learn a few simple skills, which Hypnodontics will teach you, and I will give you some tools and some resources, you can watch all my other videos and get a lot from them, then what you'll find is a more sustainable, more enjoyable profession. So let's have a little experience if you're up for it, because influencing is great, but how do you do that? Well, exactly. Let me show you how hypnosis, if you will. And by the way, when I bring up the term hypnosis, just think of it as the effective connection that we have, the communication that I'm able to deliver to you subconsciously, simply because we've been able to build rapport and build a relationship, even through this glass that we have in front of us. Right? So if I'm able to say something that stirs up an emotion inside of you or helps you feel a sensation, for example, then you might be able to be experiencing hypnosis just like that, so quickly, just from watching this video. So if you are open to it, let's just have a little experience. If you would allow me to just direct your attention for just a moment to that sensation on your foot. Do you feel it? As you pay attention to that sensation and you just notice sort of what's different, you may begin to realize that it's either a light change in temperature, or maybe a slight tingling, or maybe something else. Whatever the sensation is not important. What's important is that you realize that we are able to come up with that physiological change and physiological response in the body simply by directing our focus, just like I did. If you think about it, all I've said is Look at, pay attention to that sensation on your foot. I didn't tell you what foot, I didn't tell you what sensation. I gave you some options as to, it might be a tingling, it might be a little bit of change in sensation. Whatever it is that you're feeling is important to understand that it is your unconscious that's here to help you and give you the answers that are right for you. And if you want to direct a patient's mind in this way, it's actually a fairly easy thing to do. If you think about the subjective scale of discomfort that a patient would have, this is a normal SUD scale that you're familiar with, 0 to 10, but let's call it the scale of anxiety, right? This is their subjective scale of anxiety, how freaked out they are to be at the dentist that moment, from 0 to 10. And the patient says, oh my gosh, I'm freaking out, man, I'm a 10, I'm a 12. And you want to bring them down from there. The first step that you can use is to show that you care, is to simply ask questions so they go, this is a little different. This is not just them wanting to sell me something, this is actually them connecting with me. That will bring that feeling of 12 to a 10, maybe to a 9 or an 8. Now, if you want that same feeling to be a 7 or a 6, then maybe you would have a more candid conversation with your patients about the procedures that they're going to have, or their finances, or just a little bit more of a normal, easygoing communication rather than something that's so stuffy. Maybe something a little bit less clinical. Now, if you want that patient to experience maybe a 5 or a 4, you could spend 3 minutes teaching them a really simple breathing exercise. Okay, breathe in through your nose for a count of 7, and breathe out nice and gently for a count of 11. And that's a moment that you can spend with your patients. And what happens is, when they simply take a few deep breaths with you and you are helping them, you're going, okay, let's do it. As you sigh, you are activating the parasympathetic system, and you are allowing your body to sort of go into that rest and digest mode that gets a patient to relax. The vagus nerve, when you exhale audibly, your vagus nerve gets tickled and gets stimulated, and it feels good. It allows for good feelings to flow in that person. So how about bringing that feeling down to a 2 or a 1? Do you think you can do that? Absolutely. You would have zero problem doing that if you just learn to use the simple skills that I can teach you in these videos and in my book and other resources. So if you think about it right now, think about what's happening with you. Are you still feeling that sensation on your foot? How are you doing? Are you focused on our conversation right here, or are you distracted? While I'm talking and while I'm helping you sort of go through these physiological sensations of your own, do you feel as if you are disconnected from the outside world for a minute and we're just having this nice, close conversation? That's what hypnosis is all about. So let me show you what my little girl calls future ball. Future ball is a crystal ball that lets you see your future clearly. Now, it's actually a tool that I use to visually explain how we use very simple techniques. Like right now, I'm using these very gentle, very easy, very simple hand manipulation techniques to make it seem like this ball is floating. Do you feel like the ball is floating? If I do this, does it feel like it's floating? Does it feel like it's lightweight, going away? No. In the dental practice, we can use verbal techniques to manipulate the perception of dentistry, which is what dentistry needs to be able to get rid of that sort of adversarial situation that begins on that initial phone call. If dentistry didn't have that adversarial relationship, then your connection with your patients would be a lot easier. Your interaction with them would be simpler, because you might have gone to school and learned a lot of great clinical skills, a lot of great information that's important to you and your practice and your development and your career. But you probably were never really taught or never really told that you would have to convince patients to do what's in their best interest, right? That you, an adult, would have to convince another adult to do something because it's good for you. Well, to an extent, yes, we want to do that. But again, convincing is not where it's at. Influencing is where it's at. So reducing the friction at every step of the way is important, and changing the perception of dentistry in the public is what's going to begin that step of reducing the friction. Does that make sense? If you've reduced some friction and they come in and they're a little bit anxious and you take them through that process 10 to 0 and you help them with some breathing exercises, they, even if they are still a little bit scared afterwards, they're going to feel like you cared so much and that you try to help them, that they invariably are going to have a much better experience than when you don't do that. So let me see if I can show you a tiny bit more of this. It's just called contact juggling. And it's something that I bring out to my audiences sometimes as a fun tool to illustrate a point. So, my friend, let's take a look at our future together. If you were to think about yourself and your practice over the next few days, over the next few weeks, doing what you normally do, going through your day like you normally do, imagine paying attention to those moments where your patient needs a little bit more. Being so patient-centered in your approach and in your thought process that if a patient is a little bit anxious, instead of ignoring it, you approach the patient and you say, "Hey, Mary, I notice you're a little anxious. May I ask you what it is?" And then simply the act of caring, like I said, will start bringing them down from that subjective scale of discomfort, right? So in our future, if you can see that for yourself, hopefully there is some collaboration, because I can bring a lot of different skills to your team that would be useful and important, not only where it comes to their mental health and your mental health and improving the sustainability of your practice and the happiness of your practice, if you will, but also where it comes to the bottom line of your practice. We're talking about improving case acceptance, reducing the number of no-calls and no-shows, influencing patients to do what is in their best interest, right? So patient adherence to your instructions, patient relief from certain habits and fears and issues like teeth grinding, smoking, all the hypnotherapy things. So there is a variety of ways for us to work together, and I guarantee you that if you have a team of 6 and all 6 take one tip from me, you are going to change what's going on at your practice in a positive way. So I hope that you will join me. And now let me tell you about the few tools that I have for you, which are included in this presentation. Well, my elbow is a little tired now. All right, tools that I have for you are twofold. The first thing is a prescription pad. So this is a simple prescription form for hypnotherapy services. So when you have that patient who's grinding, that patient who has overactive gag reflex, those patients who may be trouble for you in some ways, you can use this referral form to send them my way. You can get the form by going to hypnodontist.com/RX. RX like a prescription. It's a prescription form. And you can also start with my book. I'll tell you what, after several months of working inside the emergency dental clinic, I realized that I had brought the no-shows from many a day and many a week to almost non-existent. So I realized that the way that I was communicating with patients was improving. Then I was also improving in the way that I was selling treatment, and the practice was seeing improvements in their bottom line. And that's when I wrote the book. The book is Hypnodontics, Ethical Influence, Language for Dental Professionals. I call it ethical influence because it is ethical to influence others, to persuade others to do what's in their best interest, right? It would be unethical if you would say, "Hey, you need a crown," when you don't, just because it makes you money, right? That would be unethical influence. Ethical influence, language for dental professionals, meaning that I've connected the professions of hypnosis and dentistry. So the book, Hypnodontics, will give you a crash course on hypnotherapeutic language and neurolinguistic programming language for dental practices specifically. The book was #1 in dental practice management and hypnotherapy back in 2014 when it released, and as a matter of fact, I think it's still in the top 100 list on Amazon. So, it's done well, and I would love for you to take a look at it and give me your feedback if you like. All right, so those are 2 tools that I have for you, and when you go to the hypnodontist.com/RX link, you're also going to get an entire packet of downloads. It's actually 5 files in there which are for the videos that are elsewhere on this page or this platform. They are the patient experience blueprint handout, which is my entire presentation. It's like 40 something pages. You don't need to know what all these are unless you're watching the other videos, but I'll tell you what you have. You also have a patient comfort intake, which is something you can print and use with your patients immediately. It's unbranded and it's an excellent practice for you to start doing at your office. And then there's also a 2 hypnotic technique outlines, and these are hypnotic techniques that I teach in other videos like this one that will help your patients. For example, that patient that came in as a 10 and you're like, well, how do I make him be a 1? Well, this is what those techniques are for simple hypnotherapy or NLP based, neuro-linguistic programming based techniques that help your patients reduce or sort of change their state, and you can help them actually have treatment when they were really freaked out, for example. So those are the things that are inside that packet if you downloaded it. And there's also the dental practice optimization assessment sheet, which is something for you to self-assess. Of course, if you want to send it to me and get some tips, maybe a lunch and learn for your office, then we can do that. Feel free to send it to me. The instructions are there. All right. I think that's it for now. If you'd like any help with implementation of any of these skills, please feel free to find me at hypnodontist.com or email me directly at juan@hypnodontist.com. Thanks for watching. I hope you enjoyed it, and I'll see you next time.